Hey everyone, just a quick video here. I want to talk a little bit about sitting and lower back pain. A lot of people don't know this, but lower back pain is the #1 leading cause of disability globally. And it's been observed that sitting for prolonged periods, that's between 1 hour and 7 hours, has been shown to lead to back pain in many people, regardless of whether or not they're having a current episode of lower back pain. One of the popular reasons for why this is happening is from flexion. So when your lower back, sitting on a chair, tends to kind of collapse a little bit this way, it puts a lot of stress on the tissues, and that increased stress and strain can lead to discomfort and pain. So, flexion, when you're sitting, you'll see that happen a lot with people where they have that posture where they kind of let themselves kind of roll down, their shoulders become slumped, their lower back, they kind of sit toward the back of their sit bones. And that's one of the things that kind of creates a lot of those problems. So there's some, a few possible solutions that you could try and do. First thing you could try and do is try and get up. So that'd be #1, get up more frequently, every 20 or 30 minutes, get up, walk around for a second, or just even stretch above your seat, just standing up and moving around, getting your body moving in a different way, and then going back to sitting. That'd be a good way to kind of get things started. #2 is just to sit more on your sit bones. So when you're sitting on your sit bones, there can be sit bones like this would be neutral, and when you sit back on your sit bones, that's what creates that roundedness. So you can feel that when you sit back on those sit bones. But at the same time, what a lot of people will end up doing is they'll end up sitting too far forward. So they're sitting on the front of their sit bones and they're really overarching. And there's been some research showing that if the lower back muscles are overutilized, it can actually compress some of the blood flow and reduce the oxygen that's going in there. And that can create some problems too. So you don't want to be too slumpy, but you also don't want to be too straight. So you want to kind of find that in between spot where you can feel your sit bones being right at the peak. And if you roll back and forth between them, you can kind of feel when you reach that peak and when you come down on either end of it. The last thing you can try and do is something that a lot of people don't think about is recognizing that the middle back plays a big part in people's ability to sit and stand appropriately. So if you try and get your chest to elevate a little bit without your sit bones rolling, that's a good way to use these big muscles in your middle back to help support and anchor yourself in that good, appropriate position where you're putting less strain into the flexion of the lower back or into the extension of overarching. So those are my few tips for today. I hope you guys enjoyed it, and yeah, hopefully I'll have another video out soon. Thanks, bye-bye.